because your patient trusts what you do. They trust you when you tell them, see, look at what I've done, because when you've done this, you've given them confidence for you to continue. And this is a very important treatment trick I would like to share with you. Our second volunteer here is Hanan. ازيك يا حنان؟
Alhamdulillah, okay. How are you?
I'm good, thank you, darling. So, Hanan is different to our first volunteer, Sarah. Hanan has a fuller face. You can see Hanan has also had some work done in the past. Yeah, probably a bit of Botox, some fillers. However, at the moment, we want to avoid using too much fillers, because I think with a face like Hanan, she doesn't need any more fillers. We need to work with other tools. And here, something like Profhilo Structura becomes a good option. If we look at Hanan is likely to become more of a sagger as she ages, because the skin will sag. It will basically come down. She has a heavier cheek, heavier lower face, and as we age, this will be more droopy here. So with her, we can use the Profhilo Structura. We're just going to inject it slightly differently, because we want to actually target even this part, because this part is where she's starting to lose also some of her adipose tissue. So if I'm to inject her, I'm going to basically come all the way here and then here. So what I'm doing is I'm actually spreading the product. So we're still using 1 ml on each side, but we're dividing it into 0.5 on each side. Again, we're going to use the cannula. Again, it's quite a thick G' product, so it is a bit hard to push, so you have to just go very slowly. Make sure that your cannula is intact and it is well connected. So usually with the thinner faces like the sinkers, we tend to come 2 centimeters from the tragus. With a face like Hanan's face, I'm likely to go a bit more forward, so it's almost 3 centimeters from the tragus. So we can start. We usually will go almost 3 centimeters from the tragus, so we're becoming more forward than the previous patient. It's just because you want to cover this area as well for her. So basically, I'm going to come from here, gonna small break, 1, 2, 3 coming. Well done. You're okay? Mm-hmm. Well done. Let's prep it right. So you could start here or down, up, doesn't matter, but as long as you make sure you're going to cover both areas. Now I usually stop here because I don't want to go medially, because this is already a fatty area. I don't want to encourage more fat here. I want to go literally to the area where the fat loss happens, which is usually here. So what we're going to do now is we're going to inject 0.5. We come retrograde. I'm doing it slowly. There's no need to rush. Okay? Now, you don't have to go out. Try to turn, basically, and then go downward. Again, we're going in the deep layer. We want to go subcutaneously, and then basically here. Again, another 0.5. You're okay, Hanan?
Mm-hmm.
Well done. And we are finished with one side, huh, Hanan?
Okay.
You're okay? Mm-hmm. So I always make my patients sit, have a look, and decide. Yeah, good. Actually, there's something you can see here. You know, sometimes people think when we are restoring fat, we're making the face bigger or fatter, and no one wants a fat face. Actually, no. What we're doing is we're slimming their face. So restoring fat does not mean that you are giving them more fat in their face. You are just helping the adipose tissue to regenerate, so it will fill the dents that happen in that area. And I think that actually it makes your face look slimmer. And you can see it. Look at your face now. We look at the side we injected. She looks slimmer than the side we did not inject. Yeah? The face here looks more lifted. The face there looks bigger and more fuller. Here looks you're lifted and slimmer. Here you look like you've lost fat. Do you see that?
And
So I think this is one of the things you could see when you inject. Of course, again, this is just an immediate effect. This is not, I'm not saying this is the final look, but what I'm saying that when you're using these products, you could actually help sculpt the face. Depending where you place the product, you can make your patient's face look slimmer, lifted, and it helps them to even feel very happy about themselves because they want that look. Most people want to look slimmer, lifted, tightening of the skin. So it's a tighter skin, it's more lifted, and it's slimmer. And I think with Profhilo, we used to achieve that with the original Profhilo. With Profhilo Structura, working on a deeper level even allows us to work more in that context. It's just placing the product in the right plane with the right direction. Yeah? Okay? But yes, definitely, actually, if we wait a little bit longer, you can see the face is more lifted on the side we injected. And you can see that actually your face is slimmer here, Hanan, than here. ضعفانة.
right.
Okay? So again, we're injecting around 0.5 in that area. I flip my cannula and I go downward. I try not to get out, but if you have to get out, you go out and go in again, not a problem. And then I basically inject the remaining 5.5 ml. You're okay, Hanan? Make sure you are in the deep fat. And we are done. Again, give your patient a nice massage, just makes them feel good. It's reassuring. It also allows you to feel the product. So you should be able, and I usually do this because I try to feel my products. I want to make sure that I've placed it in the right plane. I don't have any lumps, I don't have any collection in one area. It's always good to detect any problem early in case there's a problem, because you can solve it. But if you leave it and you just leave the room happy with what you've done, then you haven't done a good job. So again, as I said earlier, patients can go back to their normal life. We do advise to avoid heavy exercise for 24 hours, avoiding things like sauna, steam, extreme temperatures. But other than that, you can go back to normal life, daily activities, you can use your products. And actually with these patients, I insist on good skincare, because now that we've done this treatment, we now want to maintain it. This is the best time to use the right products. So make sure that your doctors prescribe you the right products to follow. It's not enough to do treatments in the clinic if you're not going to take care at home.